important PPE. In the past, it was not too important to wear the whole PPE. In the past, usually the technicians, they just wear the gloves, face mask, and the hairnet, or sometimes the gown when they have to reprocess the dialyzer. But considering the COVID-19, now we have to take care more about the PPE. So let's understand what are the essentials of donning and doffing and in change in practice due to COVID-19. COVID-19 has resulted a significant disruption to normal practice in the Philippines and around the world. Hemodialysis is an aerosol generating procedure and likely to be more infective. Transmission in the hemodialysis setting can occur through droplets or direct contact with contaminated fluid. The spread of COVID-19 during hemodialysis procedure can be minimized by adopting correct PPE and can be effective if worn correctly, which we call essentials of donning and doffing. Donning means putting on the gear, and doffing means taking off the gear. So there are 7 steps of the donning. Number 1, you have to identify and gather the proper PPE for donning. Perform hand hygiene using the hand sanitizer. Just to remind you that hand hygiene is very, very important when it comes to the spread of the COVID-19. Make sure that you will wash your hands properly for about 60 seconds. This is guided by World Health Organization. Put an isolation gown. Make sure tie all the ties, and if needed, you can ask healthcare workers for assistance. Put an approved N95 or higher if you are going into the COVID area. But if you are just in the hemodialysis area, you can wear the face mask. Put on the face shield or goggles, which is ever available. Put on gloves. Make sure before you put gloves, wash your hands and no tears. Sometimes we are using a small gloves while your hands cannot accommodate. Your hands are a little bit bigger than a small hand. So make sure you can wear the proper size of the gloves. Otherwise, it will be tears and you will be infected. You can now enter into the patient's room. So this is very important for you. Before you enter into the patient's room, you have to do the donning first. Do not enter directly to the treatment area and then you can do the donning. Otherwise, it will be waste. Then we have a doffing, which is taking off the gear. It again have a 7 steps. The most important part here, just to remind you, and please remember, remove the gloves first. Do not remove the gown. Remove the gloves, then remove the gown. Then you can exit from the patient's room or from the treatment room. Very important again, hand hygiene. Wash your hands again for 60 seconds. Now you can remove face shields or goggles, remove and discard respirator or the face mask,